So in this video, let's discuss the following topics, starting with a question on screening. So let me know if at all there is a question on screening, because I got one of the keywords as screening. So as you know, screening is an opportunity to detect early dental or oral health problems. We're talking in specific about dental screening. So screening is not a replacement for complete examination in a dentist's office. However, dental screening can be an important component of an oral health program and an important element of a school health program. The screening should look for presence of dental caries, periodontal disease, malocclusions, trauma from oral injuries, etc. So it's a process to identify the extent and spread of a particular infection or particular disease in that local community. Screening, right? Now let's move on to the next question. SCR protocol was not asked directly, but there seems to be a question from that protocol. So in case of highly affected or highly caries affected patient, which are the following agents or topical fluoride agents is applied? So selective caries removal protocol. This SCR protocol can be applied either on a single tooth being treated or to several teeth in a caries control phase treatment. High caries risk patients with multiple cavitated caries lesions can benefit from the treatment plan designed specifically to gain control over rapid progression of their disease. The term caries control refers to a procedure in which multiple teeth with acute threatening caries are treated quickly by application of medication, that is, example SDF, to arrest the caries lesions, and also by removing the infected tooth structure, medicating the pulp if necessary, and restoring the defects with temporary or definite material. So as you can see in this table, which is very important, you can find that silver diamond fluoride 38%, there is 96% caries reduction, 96% for caries arrest and 70% for caries prevention. Right, you can make a note of all these values. Consider this table very important, along with the concentration of fluoride in various methods of fluoride delivery. Right, moving on to the next question. CPIT in treatment needs, they might have asked you a question pertaining to the same. So as you can see, we have different codes and different treatment needs. FDA WHO Joint Working Group on Periodontal Diseases supports the use of CPIT as an epidemiological screening procedure for periodontal treatment needs in populations. The Community Periodontal Index of Treatment Needs, CPIT, is an epidemiological tool developed by World Health Organization for evaluation of periodontal disease in population surveys. So as you can see, we have different codes 0, 1, 2, 3 and 4, and also treatment needs 0, 1, 2 and 3. So in case of code 2 or higher, it indicates a need for professional cleaning of teeth and removal of plaque retentive factors. Patients require oral hygiene instructions, and also shallow to moderate pocketing, that is 4 or 5 mm, which is code 3. Oral hygiene and scaling will reduce inflammation and bring 4 or 5 mm pockets to values of or below 3 mm. Thus, extents of these pockets are placed in same treatment category as scaling and root planing, that is treatment needs 2. Right, I hope it's clear. Now moving on to the next question. Anti-slow, there seems to be a question on the same based on pericemmental area, which you're all familiar with. Fixed partial dentures avoided in cases with long span edentulous arches because they produce excessive forces on abutment teeth. Anti-slow determines if a fixed prosthesis can be used or not. What is anti-slow? As you know, pericemmental surface area of abutment teeth to be used for fixed partial denture must be equal to or exceed the pericemmental area of teeth being replaced. Right? Now moving on to the next question, which should be prepared first, occlusal rest or proximal reduction, which has to be done first. So if you review literature, and also as we discussed about occlusal rest seats in one of the videos previously in e-classes, the preparation of occlusal rest seat always must follow proximal preparation. Preparation of tooth surface is necessary to provide proximal guide plane and to eliminate undesirable undercut. Consider this very important. If the proximal preparation follows occlusal rest seat preparation, the marginal ridge is too low and too sharp with the center of floor of the rest seat too close to marginal ridge. Hence, this has to be avoided. And also, as we have discussed in our E-classes, the angle formed between the occlusal rest and a line drop down the proximal surface of tooth must be less than 90 if the rest is to be effective in transferring the forces on partial denture, as we discussed in our E-classes. Now moving on to the next topic, Langenbeck retractor. The uses were asked, I guess. So if you review literature, Langenbeck retractors, they are used for retracting soft tissues and wound edges in order to visualize deeper structures, designed by German surgeon Langenbeck for urological procedures, and are now used for plastic, urological and general surgical procedures. So let me know if at all there is a question on the same, or if you need any additional information, do drop a comment. Moving on to the next question, resonance frequency analysis related to implant stability. Was it asked in exam? Again, do let me know. So if you review literature pertaining to RFA, initial stability at placement and development of osseointegration are two major issues for implant survival. Implant stability is a mechanical phenomena which is related to local bone quality and quantity, type of implant, placement technique used, as you all are familiar with. The application of simple clinically applicable non-invasive test to assess implant stability and osseointegration is considered highly desirable, and resonance frequency analysis RFA is one such techniques. Also, resonance frequency analysis could serve as a non-invasive diagnostic tool for detecting implant stability of dental implants during the healing stages and in subsequent routine follow-up care after treatment, right? So this is some information pertaining to RFA. See if it is helpful in answering the question. Moving on to the next question, RH incompatibility is associated with which type of jaundice? As you're all familiar with, it is hemolytic jaundice. So as you're familiar with, RH incompatibility doesn't cause signs or symptoms in pregnant women. In a baby, the condition can lead to hemolytic anemia. Hemolytic anemia is a condition in which red blood cells are destroyed faster than the body can replace them. We discussed about HDNB, hemolytic disorder of newborn, or erythroblastosis fetalis, a number of times previously as well, right? Now moving on to the next topic, syphilis. Which stage of syphilis is associated with systemic complications like aortic aneurysms? It is tertiary syphilis. So let's review some literature pertaining to the same. Syphilis is an infection which is known for a very long time and is caused by Treponema pallidum. It can be transmitted either sexually or even congenitally. Due to widespread use of antibiotics, the tertiary stage of syphilis is currently extremely rare, being the cardiovascular and central nervous systems the most commonly affected sites, even if asymptomatic. Among the cardiovascular complications caused by tertiary syphilis, aortitis is the most common, in which 10% of the patients develop meaningful critical complications. In non-treated syphilis, aortitis occurs in over 70% of cases with symptoms such as aortic regurgitation, stenosis, and aortic aneurysms. So these are some points of interest concerned with this topic, right? So I hope it's clear. Now let's move on to the final topic, thyroid cancer. Which of the following thyroid cancers is associated with increased calcitonin release? So it is medullary carcinoma. Medullary thyroid cancer. The expression of calcitonin by medullary thyroid carcinoma defines the C-cell origin of this tumor and serves a valuable role in monitoring the progression of disease. As you know, C-cells are parafollicular cells which comprise around 2 to 4% of the organs cells, right? So these are some of the topics which I wanted to highlight in this specific video. I hope it's clear, and if you need any additional information, drop a comment. We'll update that accordingly in the description part of the video. And also, if you have any additional key points or keywords, drop them in the form of comments. We'll review them in the coming videos. Wish you all the best. Love you all.